I thank everyone for attending Candid Pro's session on Choose Predictability, Aligning Airway Health and Occlusion, presented to you by Dr. Diana Batoon. My name is Sandra Lambert, and I am part of the clinical education team here at Candid Pro, and I'm very excited that you've joined us for this evening's session. So we have a few housekeeping items to cover before I turn it over to Dr. Batoon. So I'd like to let you know that this session is being recorded, and an email will be sent at the conclusion of the webinar with a link to the recording. Also, there will be a QR code at the end of the recording with a link to a quiz. And once you complete the quiz, you will receive 1 hour of continuing education credit for listening to Dr. Diana Batoon tonight and learning all her tips and tricks and pearls. Also, Dr. Batoon will take questions at the end of the session. So if you have any questions that you would like for her to answer for you, if you could kindly put those into the Q&A section on your Zoom platform here, and then we will get those questions answered at the very end. So thank you all. Enjoy the show. And Dr. Batoon, I'm going to turn it over to you. Thanks so much.
Thank you, Sandra. Well, hello to all of you. Good afternoon, good evening. I'm so grateful for you to spend this hour with me. I'm hoping that you can take some of the things that I talk about, that I share with you, to your offices on Monday morning. Or if you think of a patient that's in your existing practice and how clear aligners, or specifically how Candid Pro, can help that treatment plan. So let's, let's see. I'm going to share my screen here. Let's see. So a little bit about myself. I went to Tufts University a while ago and did a GPR residency at the VA Loma Linda. And then I moved to Arizona, where I opened a private practice named Bonita Dental. But in 2018, I opened a separate medical practice dedicated to sleep and TMD and craniofacial airway dentistry. I'm a diplomat of the American Board of Dental Sleep Medicine, and I teach part-time at Midwestern University out here in Arizona. You know, I'd say that I learn from my failures that I've had in my practices, or when things didn't quite go the way that I planned. But I'm a lifelong learner. And when I see that there are opportunities where I can be a better general dentist, I'm going to dive deep into that level of service. And clear aligner therapy has been a big part of my practice. My clear aligner journey started out probably like most of you, where after I was doing general dentistry, I started to do a lot of cosmetic dentistry, started to dive into full mouth rehab, CAD/CAM dentistry, and implants, did a curriculum for implants, did a curriculum for aesthetic dentistry. I mean, I was a CE junkie. But I think when clear aligners first came out, I really thought that clear aligners was just for the orthodontist. But when I started to look at companies that were teaching general dentists, I thought to myself, why can't I offer this in my practice? And I think that's one of the best things I did, to not only start integrating a different level of service, but to offer something that my patients were asking for. They did not want to be in braces. I had a lot of adult patients that wanted to straighten their teeth, but they did not want to do brackets and wires. They wanted to do a treatment that didn't interrupt their life. They were more concerned about the aesthetics of straightening their teeth, but without having to stop eating certain foods, not having to go into a practice because their bracket fell off. They were busy individuals. And as I started to keep doing clear aligners, I found that adolescents, teenagers, young adults, and even children with mixed dentition were looking for clear aligners. I think that's what's great about the clear aligner market, is the marketing that has been done in the consumer market has been so tremendous, and it's benefited the profession of dentistry. So if you're not offering it, it should be something I think that should be in your back pocket, because the way that they have improved on the material, the technology that goes along with clear aligners, it's in a different space of its own. So every general dentist should be able to offer this product as ways to help move their patients into proper optimal oral health. One of my Candid Pros what? Personally, I just enjoy offering a different level of service to giving options to my patient base. Professionally, I feel confident that using a system that is paired with artificial intelligence is moving into a different level of, I think, accuracy. It's moving to better treatment, and it's supporting what I need to get to. And that's making sure that my patients have straight teeth, their bite is comfortable, it's functional, and also that my team really sees that this product is making a difference. People love to look good, and they're not going to necessarily tell you, but they feel good. And most people will say, I wish I had straight teeth. Oh, my parents couldn't afford it. Or, oh, I just genetically had something going on. It wasn't an option for me, or I couldn't afford braces. There are so many reasons why people look for clear aligners. But in my practice, I found that we consistently have strong support that ultimately promotes great confidence, not only in the patients that we treat, but with our dental team. My Candid Pro how is stems from, some cases that I thought were more difficult. If I had a molar that was mesially tilted and either I was going to do a future implant in that space, maybe I was faced with malocclusion that came primarily from genetics, came from maybe oral habits. So this is why I thought, okay, I'm going to integrate clear aligners, and it's an option. And what's great about this is you can treat one arch, two arches, or both arches at the same time. And to give that capability to use it with your restorative needs is so tremendous. I just talked about oral habits. You have children or sometimes adults who maybe went through phase one orthodontics and for whatever reason, due to compliance, never completed their orthodontics, or they had relapse. And did they have a genetic predisposition due to oral habits like mouth breathing or tongue thrusting that contributed to that relapse? That really set me into moving towards the path of airway dentistry or airway focused dentistry. Because I think when we step out of the box and start to take a look at what we've learned in dental school or our dental school programs, and for example, like bruxism, I was taught when I went to dental school a long time ago that maybe grinding was a result of a bad habit. It is. But now there's a lot of research and evidence-based dentistry to support that maybe bruxism may be associated with a restricted airway or TMJ or a sleep-related breathing disorder. There are so many facts that contribute to that. It's not just one piece. It is a combination of some things that are putting together a puzzle, and that puzzle is what our patients clinically present with. So I feel like I'm not just putting these things together, but I'm really trying to give my patient what's the best overall picture for their optimum health. Maybe they're just looking at aesthetics in their front teeth. Maybe you have patients in your practice that are just biting down on one side. Or maybe you restored crowns on the lower left and your patient says, oh, doc, those crowns that you did there, it bothers me. I feel like my teeth are not coming together in the right way. We've all had those patients, but what I believe clear aligners does is it gives you an option for the general practitioner to not only offer something to correct the occlusion or the malocclusion that's going on, but offer a level of service that doesn't seem so over the top for the general dentist. The material and the way that technology in clear aligners has evolved, I have seen that some of maybe my most difficult cases now become easier clear aligner cases when we look at what we want as far as the ultimate picture. The great thing about clear aligner therapy and why I chose a company like Candid Pro is that it's supported by certified orthodontists, that each of them are looking at a setup for you. To me, that's very important as a general dentist. I want to make sure that the eyes that are looking at this treatment setup is by somebody that is qualified and that also is available to me. So if I had a question or I had a suggestion or maybe even a disagreement or just wanting to find out why was the setup done this way, that they're open to discussing the case with me and open to seeing like, well, how can I make that option better? Or why didn't you do it this way, doctor? That isn't what you get in a lot of other companies, right? You may just get a technician that's in a different part of the world that is just looking at your setup. The other thing that I was looking for was to get support, even though I was a general dentist. I may not be doing so many clear aligner cases that I'm at the top of their list. So now I've got the top technician that's working my case. I feel like every case that I've been using Candid Pro, an orthodontist is looking at this setup to see if what's the best option for my patient. My last Candid Pro Y are these three guys. These are my boys. And you know, what's funny is when you're a general dentist, and I've been in practice over 25 years, I've actually practiced on them a lot. In one of my kids, my middle son, I did expander, braces, I did functional appliance. In my oldest son, I did a functional appliance, and now he's in aligners. My youngest son, I didn't have to do anything because I started paying attention to his oral habits early on, but he's probably going to be a clear aligner case. It's not very difficult. But what I think it did for me was it helped me understand that every individual is different, every malocclusion is different. And so I felt like clear aligner therapy was an option that I could give to most patients in my practice. So here's our agenda today. We're going to talk a little bit about malocclusion and that ortho opportunity, how to identify patients that you could possibly treat. What does that clear aligner landscape look like? And how to leverage the clear aligner system in your practice. And lastly, I'm going to share with you a couple case reviews. So first of all, let's talk about malocclusion and the ortho opportunity. I talked a little bit and I mentioned about the marketing that's going on in our world, in the US, but all over the world as well. 75% of your patients, and if you think about that, if you think about all your hygiene patients that pass through your practice every 6 months, they could benefit from clear aligner therapy. And that's a statistic that came out of the American Association of Orthodontics. And I think what's interesting is that the role of, or the incidence of disease in the US keeps climbing. The incidence of respiratory disease and sleep apnea keep increasing. So what we find is that some of those patients have oral habits that really, if looked at more closely, can benefit from clear aligner therapy. So to apply this in your typical practice and to kind of give you an idea, you know, if you see 8 hygiene patients per day, that translates to 32 patients a week. 24 of those patients are possibility. Well, that translates into 96 clear aligner patients a month. That, if you look at the numbers, if we're talking about production, possible missed opportunities, is a huge number. And the idea is that we are not talking about it enough in our practices. We're just, dentists tend to look at like one thing. You have a cavity, let's fix it, it's done. You have a broken down tooth, it's fractured, let's do a crown. But what is the reason why the tooth got fractured? Why are you having a high risk for decay? Why are you having a higher risk for perio? Is this something that if we did clear aligner therapy to correct the malocclusion on your lower anterior, that would help? It's a progressive disease, and that's what I think that, you know, a lot of practices don't talk about. I know if you look at these pictures, you have seen these patients in your practice. You see abfractions all day. You see fractured fillings. You see people grinding. They're losing their incisal wear. What is the reason? It is a progressive disease, and to really slow it down to where maybe patients are not doing that oral habit is to look to see, do they have enough space in their mouth? Is there enough space for the tongue? What is the reason why they're grinding in the first place? What can happen if it's left untreated? Well, that malocclusion could lead to physical issues and functional issues. Some of that could be jaw problems. I don't know if you know this, but in evidence-based dentistry, 50% of your patients who have a sleep-related breathing disorder may have an association to TMJ problems. So I know you can think of patients in your practice that right now have chronic jaw pain. that complain of muscle or jaw pain on their masseter muscles. What is the reason? Also, malocclusion could lead to an increase of tooth decay, tooth loss, and gum disease. And if there's anything that you've been reading lately in the news, is that gum disease has been long-standing been shown to affect some other cardiovascular effects, making them at risk for certain things like hypertension, diabetes. Those are the patients that maybe you should pay attention to more. Why are they having these physical issues? And then looking to see if malocclusion is a causation of their existing condition. So identifying the cases is as simple. You've been doing this all along in your practice, especially when you see your patient every 6 months. Your hygienist is looking at maybe identifying pocketing, abfractions, looking at the periodontal disease that's existing. Well, there are many common types of malocclusions that all team members can help identify. They don't have to diagnose it, but everybody has an idea. Is their teeth in the right space? Are they hitting in flat spaces? Are we causing uneven wear? Is that due to crowding, spacing, or a deep bite? Does this patient have an open bite, propensity for class 3? Why is the midline off? And then also paying attention to people who have a deep class 2 or an edge-to-edge bite. This is what is in your practice. And if we look at it just a little bit differently, is there something that we can offer this patient to set them up to stop having those incidences of more decay, dry mouth, malocclusion in their bite? We just need to take a look at it and see how we can offer, and maybe, and I say high maybe, that clear aligners may be a solution to some of these problems. Simply asking your patient to smile, right? Most patients don't know what their teeth look like. I don't know if you have a scanner in your practice, but we do. We have multiple scanners in our practice so that at any one time, any one of the team members can scan a patient, so that people are very visual nowadays and they don't understand that, oh, do you see that your edges on your front teeth are uneven? Why is that happening? Why is your canine longer on one side than the other? Why are you wearing your lower front teeth? Does it bother you that all that enamel is gone? And why do your teeth become tipped like that? Is your bite or your habit of grinding or clenching causing some movement in your teeth? The last thing is, we know that enamel is the strongest thing in our body, even stronger than bone. So when we start to see the breakdown of that enamel, what is the causation of that, and how can we improve and stop the progression of that wear? Shifting and slipping of contacts, it's present, especially if you're doing some crown and bridge. And maybe, I know you have patients in your practice when you've restored 8 and 9 on the sizal ledge, maybe a distal buckle on number 9, and you put a pin in there for retention, and now they just fracture it. Is it related to the bite? Is there more force on the front teeth and not enough on the back? So now we have a occlusal problem, because we know that in order to maintain the health of our teeth and the length of some of our front teeth, that we really should be biting more on our back teeth than on our front, right? Crooked teeth. When we ask our patients to smile, what do we see? Do we see spaces in between them? You know, and I don't want to go into, you know, class 1 canine and class 1 molar, but do you know what that looks like? Is your patient having some interferences that are causing some uneven wear in spaces that they're not supposed to? Is it causing trauma? Those crooked teeth, is it causing their occlusion? Is it causing trauma to other teeth? Is erosion a factor? So now you're getting wear of that enamel. Then sizal wear is very common among people who have malocclusion or crooked lower anterior teeth, because number one, maybe they're not able to clean there, and wouldn't it serve them better? Because we know that they can clean better when teeth are straight. So when we ask our patients to open, can we see some wear either on their existing restorations, their existing fillings, or their existing enamel incisal edges? You have patients like this in your practice, and you wonder, What can you do to fix this? Is this a possibility? Maybe it's a 72-year-old male and he's old. He thinks he's only going to live for 2 more years. And why should he fix his teeth now? To be able to help him identify that this is not healthy. We can improve this so that you're able to retain your very own teeth longer, because that's what's happening. People are retaining their own dentition longer, they're living longer. So how do we maintain that? Because most people don't know when they start losing their teeth, they can't chew properly or they're favoring one side. And to kind of explain to them, we want to preserve what you have, Mr. Jones. We want to preserve those 2 crowns on the upper right that you spent a lot of money on. I think that we can do something here and help things function better, right? What do you see when you take pictures and when they smile? Do you see any open spaces, any open bite? Do they have a cross bite somewhere? What's the reason for that happening? Is their occlusion premature? Are they biting down on surfaces they shouldn't be? And is it causing uneven wear? Like in this picture, the distal incisal edge of number 8, right? Why is 24 and 25 having that much recession? Are those incisors supra erupted? Is their curve of spee off? So to understand what's really happening, we have to go back to the basics, like finding out what you forgot about in dentistry. It isn't until you start working on teeth, we have to be mindful of looking past one tooth, but to look at the whole big picture and how we could better serve our patients so that they don't need a future crown on the other side or the tooth next to it, so that they don't need gum surgery because they have severe recession, right? The clear aligner landscape has really changed. And so some of the challenges to getting started with clear aligners and practices deal with a myriad of many factors, some of which I'm sure some of you can relate to. One of that is being able to confidently do things with a timely manner. Is your experience of orthodontics in the beginning stages, or is it something that you're doing so much of that, you're not finding joy in it, right? Compliance. We find that patients nowadays, if they don't have accountability, what motivates them to be compliant with treatment that you serve, especially when it's something with clear aligners? Because when it's a crown, you're doing it same day, or they're coming back for the crown seat, or they're coming on a regular basis for their cleaning. But when it comes to clear aligners, are the patients wearing them all the time when they should? Are they wearing them 22 to 24 hours a day? What kind of practice support do you have with you supporting your team members, motivating them to confidently screen for patients that may be clear aligner patients, or if they are needing more training, what kind of support could they get? The clinical uncertainty, are we going to know where this case is going to land? Some patients will be, well, how long does it take to straighten my teeth? Do we know? Do you have an idea? And some general dentists may not know, and they may not feel comfortable discussing how long it will be. But that's what's great about working with a company that has orthodontic support in your treatment setup. They're going to confidently give you a time frame of how long it would take for this case to go to finish. The profitability of finishing an aligner case, we know prices go up, lab fees go up, and it has to make sense for the doctor. And that's why Candid is a company, one of the companies that really works towards helping general dentists profit in this level of service, as they should. And that's what's different. The support that the reps give, they give your office training, the 800 support over the phone is there for you. But also with the climate of dentistry today, where there's an increasing number of staff turnover, how do you get those new people up to speed? And that's where you really want to have a clear aligner support system that's going to help you carry through those hard times. The challenges of getting started with clear aligners, well, okay, I know that you guys have probably done some other training. Maybe half of you have done other training with other companies. Sometimes your team isn't motivated. Let's go to a class, let's get certified. The question is, do you need advanced training? Do I need new equipment? Do I need more staff? The other side of that is, as a provider, I'm not confident that, oh, I can identify these cases that I can treat. Is it within my scope of where I'm comfortable, right? How do I present those treatment options? Is my office manager or my treatment coordinator able to convert the patient after I've identified why they should do clear aligner treatment? And then developing those treatment plans so that every one person in your office feels comfortable discussing. And that's really where I think that, this company sets that apart, is they are there all of the way. I have had tremendous support, but I think for me, I'm a very type A dentist. I really need to know specifics. I really need to know the end result of my case. And I like to look at a software where I can comfortably predict this case is not tracking. What do I do next? And that's where the orthodontic support comes into play. Most clear aligner solutions fall short because either it's too complex, right? Or is this going to be an elastics case? Is this going to be, what are we going to do? Are we going to have to do a rapid palatal expander? Or is it limited? Is this my practice? Is it going to be able to identify with the patient base in my practice? Am I in a good demographic? Oh, I don't want to do any more refinements. Am I going to have to do refinements after this? Or the problem is doctors think too much and they're not looking at, well, let's try it. Most people don't understand that the reason why the case doesn't go to the setup or the desired result is maybe we weren't able to track that the case was not tracking properly so that we can get the patient back in and rescan them to avoid minimizing how many refinements we have at the end. Candid software, Candid Aligner Therapy is actually very user-friendly, not only for the team, but for the doctor. There's not too many controls that if you did not have enough experience doing clear aligners, it's actually, you could figure it out. It's very simple for my staff to understand how they need to integrate and import a scan or to import a pano, a CBCT, or a lateral ceph, and also photos. In essence, you deserve more. You should expect more from your orthodontic platform. You should expect more education, more training, more marketing, more predictability, and more control. And lastly, more peace of mind. We're in an era where I think patients are more demanding and reimbursement for orthodontic treatment is less, or the plans have stopped covering as much as they did. I think at one time when I was practicing maybe 10 years ago, $2,500 for orthodontic benefit was very common. And now I see a lot of $1,000, maximum benefit for ortho. And the question becomes, how do you motivate your patient to yes, right? What kind of tools can you offer in your practice that will help the patient move to yes? And that's where I think this orthodontic platform offers that. I haven't had, if I needed help with another team member or if we needed how to integrate third-party financing, they actually provided us resources and the rep to do that. So I think that's important because the dentist should be doing the dentistry, not worrying about the financial aspect of that. And to be honest, most of your team members are probably tired of listening to the doctor tell them to do something. So it's great that there's somebody outside of the doctor that can help educate their team, but also motivate them and to help market the level of service that you offer in your practice. So let's talk a little bit about the case reviews. I picked a couple that I thought would be helpful to you understanding, but I have done all kinds of different types of aligner systems, but one of the things that, and this is evidence-based, why I think a straight edge clear aligner material is better than a scallop clear aligner material is this is just part of what they did at UNLV. And I think Dr. Ma was a very important part of this research. But the idea is what is the benefit of having, 12 different or 24 different attachments or attachments on every tooth versus no attachments. And here clearly in this evidence-based literature shows that the difference between having a scallop margin and straight edge margin is that you do get better retention. If you imagine as your patients are wearing the aligners, say for an average of, 1 to 2 weeks, every time they take off the liner to eat or brush their teeth, that scallop margin becomes, I think, a higher risk for getting distortion. Whereas a straight edge, not only is it better for retention, it's stronger as far as force. And so that's the reason why you need less attachments. The other thing is about bodily movement. They know that from gripping the aligners with the design of the aligners, the force and the stress distribution is more uniform and closer to the center of resistance. And so if you know anything about physics and how that works, this is why a straight edge aligner would work best. So this is Austin, and he came to my office, was referred by another dentist, and he had a severely rotated front incisor. And I think this is not as bad. I actually put him in a bonded RPE first. But what's great about that is because I started that way, this clear aligner case was actually easier to manage. And so why it worked for this case is that this kid was a baseball player, and I said, look, you got to wear your clear aligners, and I will give you this big bag of bubble gum at the end of it. Because sometimes kids are motivated by prizes, right? Not necessarily positive reinforcement. So with that, especially with a system that has clear aligner therapy, we came up with a treatment plan, and this is what his teeth look like. So if you look at that bite after he was in rapid palatal expansion, I'm going to just open his treatment plan here for you. I had to figure out after I did the rapid palatal expansion, how was I going to get those teeth to turn? Was this kid going to go from a rapid palatal expander to braces? He wasn't really excited about that. But what I started to see is that clear aligners was an easier option for him. So now that we have the expansion in the back, what we want to do is maybe set up the anteriors for better position so that now as 6 and 11, the canines drop down, we have space. And so rotating that central, was I going to be able to do that with plastic? Well, absolutely. And our problem with him is compliance was an issue. So this is what the treatment plan looked like. I rejected it and I had questions. And what's great about this is there was a digital footprint of all my comments, right? And I wanted to know, and if you have any background of orthodontics, as far as incisal edge, what the gingival landscape should look like. So I was asking so many questions, but what was great was this is that, okay, I forgot what he said. It was still right here in the treatment plan, right? But what helped me identify what was happening was the AI that's used in this case. And he started to be non-compliant. And so what's great about having something that's paired with AI, it keeps your patients more accountable. And so we could tell that he wasn't wearing it. If you look at the slow motion picture on the left, your right side, maybe my left side, but and so we could easily predict that, hey, you are not wearing your aligners as I recommend. So for him, the AI was telling him that he wasn't wearing it. We all know that in clear aligners, if you see a space on the incisal edge, they're probably not wearing it like they should. They don't understand they can't go to the next set without it looking funny, right? So we had to have him rescanned again. The other reason in this mixed dentation why we had to have him rescanned is because now the aligners were starting not to have a lot of retention because things were moving. He was growing. So we rescanned him, which is no extra charge to me, but it helped us show that, hey, we needed a better fitting aligner so that we could treat the patient more accurately. So in his refinement and with him being more compliant because the AI kind of called him out on it, then we went from, things looking a lot better. If you could see the lower anterior too, that we could tell he was starting to wear it. So enough space and setting up the alignment for a better position. This is Dominique. And so a lot of times we have patients that come in with TMJ problems. And what I've found is that looking, you would look at her and you go, oh, she basically has straight teeth. But she told me she really just bit, when she bit down, it was only hitting on one side. So you could kind of see what her bite looked like on the right. She was tending towards cross bite on both sides. And she was getting married. So she did not want to be in braces, number one, and she was having jaw pain. So what we had decided is number one, we did all our, she's got a midline discrepancy. Her teeth might be straight, but her bite's totally off. So we decided to do clear aligners as an option for her. And so this is what she looked like on her scan. But what was amazing is as she started to wear her clear aligners, her jaw pain got better. Well, of course it did, because now she was landing on flat spaces. And because she was biting differently on one side versus the other, she was having less strain on her muscles on her face, instead of, hitting it really heavily on one side. So she's been doing great. And she is getting to a point where she feels like she made the right decision. Because sometimes when a person shows up with this kind of bite, they're kind of skeptical at what you could do for them. But I think the best thing that we ever did was that she said her jaw pain went away, right? This was her treatment plan. And what's great about this is that if you look on the right, you're going to have comments from the orthodontist. And I appreciated this because we went through 4 versions. And I appreciated that each time the communication between me and the orthodontist was to get to move it towards where it was better for the patient. This patient also went into myofunctional therapy. So you'll find that some of the airway patients that you have, they've got an oral habit, and it could be either thrusting or lateral thrusting. It could be mouth breathing that is contributing to some of the malocclusion. And so the narrow arches could be a result of, not being more nasal breathing. This was her monitoring. And so what was great is that if you see those dots, she was getting green dots here and there, but then there was a point at where things weren't tracking as well in aligner number 9. So that's where she had to come in and get rescanned so that the retention could be better. But you can see here now in this spot, like you could see things are getting better. And then you have to understand when adults have all their dentition, we're really doing dentoalveolar movement, not so much bone. It's not like expansion. We're moving dentally, okay? Okay. Next, we have Travis. And what's great about this case is this guy came to me and said he had sleep apnea. And when we qualified him and said, okay, we can make a device, this is what he ended up with. And what happened was he was in a device already, but never wore his morning repositioner. And I said, Travis, I think we need to fix your bite first, but I can make an oral device for you that you can use temporarily as we move your teeth. So he actually is using a MyTap while we're working with him and clear aligners. But if you look at his pictures here, he's a big thruster. So we sent him to myofunctional therapy so that he could actually learn to not push his tongue forward. And so while we corrected his malocclusion, he was still in a temporary device to help manage his sleep apnea and his primary snoring. This was his setup because this is what he presented with. And you're thinking, how can I fix this? Is this something that I can tackle? I don't know, right? But if you understand what's happening with the bite and you understand, like, why did he end up like this, then can you appreciate that maybe, we're going to try to change things a little bit better to get him back where they were. And I actually did an ortho consult with this. We proclined a little bit. It's just moving it back to where naturally the teeth want to go, but also to accommodate a tongue that maybe wants to jet forward. So that's why we incorporated myofunctional therapy in his case. This was his treatment plan. And, you know, here's another example of the comments from the orthodontist that's reviewing. So I asked, we want to know, like, is this predictable? And so in his case, he's locked. His bite is locked. So what we have to do is we have to unlock that bite and allow the mandible to auto rotate a little bit, and then know that a refinement would be something in the future. In fact, his compliment to the whole process of clear aligners is that he said he feels like he bites more on both sides. His jaw pain is getting better, but that he feels like overall, like things just feel like they're landing in better spaces. So when a patient describes that to you, you know you're moving in the right direction that's going to promote long-term health for their malocclusion. This is his monitoring. You could see, except for one part where he went hiking and I don't know what happened with his aligners, but he got right back on track. And that's where, if they're not on track, you'll see red box, but when things are going good, you'll see green. But the patient sees this same AI monitoring, which I think holds them very accountable. But for him, I mean, while he's still controlling his myofunctional therapy, you could be doing so many other modalities to this. So we're managing his sleep apnea and his snoring. We're controlling his tongue thrusting by making sure he doesn't get relapse, because now we're trying to correct the bite and create a better occlusion for him. And so it's not just one thing. Can you imagine if you had to put somebody in braces and had to do all that? You have some patients that have sensory issues, and brackets and wires are just too much for them. There's limitations in what they can eat. So some people don't like chewing hard foods, and now they're going to resort to eating softer foods, and that's not what they're accustomed to. This is Jessie, and she actually tried a company that produced, less than optimal results. So she came to me because actually the patient that I just showed you was her husband, and she saw the difference already in just a few aligners at what we can do. So she decided she wanted to correct and improve her occlusion and her bite. So she decided to do clear aligners. So what's interesting about this case, and what you have to appreciate, especially by looking at her profile, she's got an underdeveloped maxilla. And so she's got some asymmetry in her face, a little bit of torsion here. If you know anything about postural orthodontics, is understanding, like, what is this stemming from? Does she have a habit, or is this in the axial atlas there? That is this why it developed that way? We don't know. But here's the thing, her face is done growing. So the only thing that maybe we could correct besides surgery is dentoalveolar movement. This was her treatment setup. And, her main concern was her front teeth. And when people come to you and they say, well, I just want to fix my front teeth, she didn't like the gaps on the laterals. So we discussed down the road, after we corrected her bite and made sure that things were stable, could she, in fact, would we be doing bonding in this case? What other options does she have to accommodate for the discrepancy size of her laterals, right? And so I think what's important to note is that we gave her some space, because she's pretty locked there in the front. Sometimes when you have a setup, you're going to have space, and that's when you can talk to your the person that's looking at your setup, like where you want the space to be, right? So she opted to be doing future bonding in this case as well. So not every case is going to be great, fine and dandy, but you have people that are in pain and they're not biting correctly and have jaw pain. And so now they're, they're looking for clear aligners as an option. This was her treatment setup. And you could see where the orthodontist commented, left space for upper lateral restorations and left the space distal. So what you're going to find is some patients, as long as the space is not in the anterior region, they're happy and that works for them, and their bite is manageable and functional. Okay. So that was her monitoring. And you could start to see, here's what I'm talking about when we find out that they're not compliant, you start to see spaces there. Okay. So with that, I thought, Sandra, we would open it up. Are there any questions, Q&A, that we want to talk about some of the education principles that we discussed?
So absolutely. Thank you, Dr. Batoon. And what a wealth of information. Thank you so very, very much. And we do have a couple of really good questions at this point. And we're getting near the end of the educational aspect of the presentation here, but definitely want to do this before we go into some more information that you have to share with us, Dr. Batoon. But there's one really good question that comes across right now is, I would love to learn more about airway improvement with the aligners. So can you share some insights on that, Dr. Batoon?
Sure. Well, I think in earlier orthodontics, I think we look at things as being more attractive in nature because maybe we're leveling and aligning teeth. Well, now the thing that's different, I think that I appreciate about the Candid protocol is that they have an airway protocol that looks to be more expansive in nature. And for me, that's important because now we're improving function, we're improving space for the tongue, and we're helping to maintain healthy occlusal, healthy occlusion. So that to me, I think versus different other options has worked beneficial for my practice because we need space for the tongue, because we need a minimum intermolar width of 38 millimeters or more. So depending of what presents itself as far as oral habits, posture, low facial tone, weak tongue posture, all those things that can contribute to malocclusion, Candid has an airway protocol that supports expansive in nature.
Thank you. And there is another question similar to that, but while we're on that vein right here, I'd like to put this out to you as well. So the other is, so how does your airway-centric approach differ from traditional dentistry in diagnosing and treating malocclusion?
Well, I think that we're looking at the whole face. So not just the teeth, it's looking at the jaw relationships and the anatomy of the patient. So whether that's their profile, their angle classification of being class 1, 2, or 3, and also looking at any interferences and possible symptoms like TMJ. So when we look at that all together, now we're looking to see how things should function to where we're not putting it at risk for either having premature contacts, crooked teeth, and then also promoting all the while more nasal breathing versus mouth breathing. The other component of that is looking to see if tongue function is part of that. You have some people that have asymmetry in their face. And so, like, for example, when you do aesthetic dentistry, is there a cant in the smile? What is the source of that? Is and usually it's the maxilla, right? How did the bones grow together like that? So, and that's another class for a different day, but muscles of the face contribute also to malocclusion. So, I learned a long time ago to know if somebody's weak tone or strong facial tone, you could put your fingers on your masseter, bite. And so the person that like their masseter pulses out, that's a strong high facial tone. Somebody, when you push and you move it further back and it sinks into their face, that means they're weak facial tone there.
Great information. And there's one other question while we're in this section. It's I feel like you've covered part of it already, but respectfully, I'd like to ask the question. You described dentistry as just one piece of the puzzle in overall health, Dr. Batoon. Could you explain how airway health and other factors integrate into your treatment plans?
Sure. I think part of it stems from when I first got out of dental school, I was told, look for decay, fix it, and that's it. But what we find is that the anatomy of people's faces now are just seem to be getting smaller and smaller. And when that happens, you have less room for the teeth. And so to have an ideal bite where aesthetically it's pleasing to the patient, you have to understand, are there any oral habits that are contributing to why the teeth present the way they are? So we look at the whole body as far as are they having a high risk for caries? Are they having more dry mouth symptoms? Does this patient have medication or a medical condition that's contributing to them to be more at risk for periodontal disease or risk for things that pertain to me as a dentist? So we look at it as what is the underlying root cause of some of these things that we see in the oral cavity. And I would say more than 50% of the cases attribute to, is it a restricted airway? Do they have an oral habit that is contributing to that? So I feel like looking at other aspects of the patient, whether it's their medical condition or oral habits, really can help identify why they present that, as far as in your dental chair. Does that make
Terrific.
sense?
That's great. I love that. I think everyone will appreciate that answer as well. So I'd say at this point that our answers and questions have been sufficiently satisfied at this point, and I know you have other great information to share with us, Dr. Batoon. So I'm going to go back off camera and let you take it away.
Sure. This is such a great area of dentistry. I think it's a great time to be in dentistry, and it's a great time to offer clear aligner therapy. You have patients nowadays, or the average consumer, which I think is more demanding, and they want more information, which is good, but they want more options. You have a lot of people that are busy with their life or are, just really concerned about the aesthetics of everything. And they want options that don't interrupt their life, but that also don't break their bank. So I feel like clear aligners is a great option for that. So one of the reasons why I chose, and many reasons why I chose Candid Pro, is it's specifically designed for the general dentist. And I think any company that is supportive of my profession with a specialist oversight really is comforting. I feel like we are getting accurate, good information to help us succeed in this type of treatment. And they work with your schedule. Like my schedule is already busy enough, and I've talked to these orthodontists at the beginning of the day, at the end of the day, sometimes late Friday. They're just very accommodating because I think that that stems from the type of company it is. They really want to see the general dentist succeed. The other thing is their software is amazing. Using AI, everybody understands AI and how powerful it is. So now you have the average consumer that's wondering, like, well, why is this better than another company? Well, using AI, that's a no-brainer. Artificial intelligence, the learning of the computer, and so they're putting all the information from all the cases that they have to increase predictability, and able to look at what the finished setup would look like is amazing to me. And it creates accountability for your patient. They don't want to come in your office. So just so you know, on all my Candid cases, most of them, I see them in the beginning and in the end. The only time I'm seeing them in between is if something absolutely goes wrong, but most of it is the training of the assistant and their ability to utilize what they need to do, like if they need to rescan, and the verbiage that they got from my Candid rep to support them in confidently giving them information. You have to understand your patients trust your dental assistant more than the dentist sometimes. So I let them be independent, and they love that they're more involved with their patient care that way. The other thing is, like I said, having that orthodontic specialist support builds my confidence. I feel very confident in treating clear aligner therapy, but with every case, because I am asking questions, I'm learning more and more of why I would do it this way versus another way. And the other thing is the technology. Who does not have a smartphone? Everybody has one. And so knowing that there's an app associated with this company and with this type of treatment really supports me as a dental practitioner. So they get like a scan box, it's their own selfie stick of their teeth, and it uploads in real time. So if they're not tracking, it'll send them a message that says you cannot move on. stay in aligner number 6. But what's great about this is you can interact with the patient via chat. So I don't comment at all. It's usually my assistants that are responding in the app. The compliance sets it apart. I mean, they can see that it's not tracking. They can see they're doing a good job. There's so many positive reinforcements about, hey, you earned a badge. Oh, look, your hygiene looks good. Keep flossing, keep brushing. You're doing a good job. That's what these younger generation patients need. They need a lot of positive reinforcement. So it keeps them engaged. And it also makes the parents feel like it's worth whatever they paid for, right? You've got more feedback than they'd ever want, but now it's holding everybody that's involved in the case accountable. So the other thing that it offers, besides marketing, the patient monitoring, and the training, it's education that's available to me and my team. That I feel is very important in this day and age. So with that, if you have any questions, I put my contact there. So if you ever have any questions, I'm here as well to help my colleagues succeed. Thank you so much for your time. Some of you might be in your pajamas already, but I thoroughly enjoyed my time with you. Please feel free to reach out to me if you have any questions or qualms about why you should integrate this in your practice. It's a great product.
Thank you very much, Dr. Batoon. And we'd like to invite everyone at this point to scan the QR code if you hadn't done so already previously. Once the educational portion was concluded, please feel free to scan the QR code here. There will be a few questions, a quiz to answer, and then generally within 2 days, you'll receive an email. Sometimes it's quicker than that. An email with your certificate of attendance for this evening. So, Dr. Batoon, I do have a couple other questions that have come through, and with respect to everyone's time, we'll use it all wisely. So, one of the questions is, how do you educate patients on the connection between airway health and their dental or orthodontic treatment?
That's a great question because after all, we're just dentists, right? What do we know? And why are you talking to me about my airway? There's a concept that I've learned and I've trained each of my team members, especially the hygienists, about dripping. You're going to have patients that aren't ready for what you have to say to them about what you're suspecting. And that's okay. We have a looping video in our waiting room that kind of, I don't want to say it sends subliminal messages, but what it's saying is like, do you have a narrow arch? Do you it asks questions. Do you get frequent allergies? Do you find that you're not sleeping well, or are you snoring? Are you feeling tired in the morning? So they're actually poised to kind of put a little plug in that patient's brain that's either sitting in the hygiene chair or in the waiting room so that they can help assess. The other thing we do is we give a Epworth sleepiness scale on every new patient paperwork. And the hygiene department will kind of qualify patients. So if they see that there's more dry mouth, there's some wear there, but asking questions, you'd be amazed what little people know about how there's a link to that. The other thing is we have a lot of campaigns on our social media about how, and people may not understand the word airway, but talking about caffeine, talking about insomnia, those types of things, and how it may be associated with some of the symptoms. And it is within your wheelhouse to talk about airway. The ADA put out in 2018 how every dentist should be screening for airway. So you should feel very comfortable at identifying that I think something else is going on. So whether you dive into it a little bit or a lot, you have every right to screen for airway. So we have books in our front desk. I think one of them's called Breathe or Sleep. There's what's the other one? I can't think of if you email me, I'll tell you the books, but we typically just put them out there and sometimes parents pick it up. There's sleep wreck kids that are on there. And so parents sometimes pick it up. The other thing is what's really powerful nowadays is social media. If you as a practice don't have an Instagram for your practice, I would suggest you look into doing that. Ask somebody that's younger than you to start it up in your practice. People all have this. They have a smartphone. and even adults are watching reels. So you'd be amazed at the information that you could share. Even getting new patients that aren't even part of your practice to support that. But just talking about it, everybody in your practice should be talking about it and how there's a systemic link.
I think we can end right there on top and on top of the hour, Dr. Batoon. And we had a few people coming through with a question, just technology in terms of watching you on their phone and how to, access the QR code. So I'd mentioned to kind of swipe out of the presentation here. You'll still be able to hear Dr. Batoon, but you'll be able to open your camera, which is generally how that works. And we'll keep this up here for a few moments just to make sure that everyone can access the QR code. If you've had any challenges with that, email as you registered, and then we can make sure that we at least get you the QR code. So no one will go unnoticed or unattended, and we'll make sure that everyone does receive this QR code here. So Dr. Batoon, your presentation was amazing, so informative. If there are any final thoughts you'd like to leave us with, please feel free. Otherwise, I think we can conclude this evening's webinar, and it was absolutely a pleasure. I appreciate you, and thank you so much.
Thank you, Sandra, for having me. I appreciate it.
Yeah,
Good
it
night
is our
to
pleasure.
everybody.
Good night, everybody. Good night, everybody. Thank you so much. Thank you again, Dr. Batoon.
Thank you. You're welcome.
Good night.
Good night.